Thank you for joining me on this week's Notes from the Field. I'm Peg Currie, Chief Operating Officer for Providence Healthcare. As the world's responding to COVID-19, healthcare is taking the biggest role of them all. We are front and center in dealing with this crisis. We continue to take care of patients in our clinics, in our urgent cares, and in our hospitals for non-COVID illnesses. Using technology, we've been able to afford our community members access to health care in ambulatory settings using virtual visits and Zoom care. Dr. Caitlin Allen, internal medicine physician at Kendall Yards, led the way in creating the virtual visit model for Providence Healthcare. She'll be sharing with you today how she set that up and how well it's being received by all of her patients.
I'm Caitlin Allen, and I'm a primary care doctor in internal medicine at Kendall Yards, Spokane. As an internist, I have a very geriatric heavy population, so the vast majority of my patients are over age 60. So when Governor Inslee recommended that, people, or even the CDC recommended those over 60 really stay home and avoid coming out, we as a community had to kind of decide, does that mean they should still come in and see the physician in person and be exposed to our staff, the waiting room, everything else? I was encouraged that we were going to start rolling out some of these virtual visits and really took the lead on helping with setting up Zoom visits. As a provider, one of the things we're taught in medical school is, laying hands on a patient and the physical act of touching a patient as a both healing nature, but also as a diagnostic. So we're already losing that by doing it through virtual care, but I feel like if I can look in somebody's eyes and see their facial expressions and hear their and watch their mannerisms as they talk, I have so much more knowledge of how much they may be suffering or not suffering than through a telephone where I can't quite see what's going on. Our scheduler calls our patients and says, Dr. Allen would like to see you, but she doesn't want you to come to the office because she'd like you to stay home. So here's some options, and which one sounds good for you. Most of our patients are open to trying the Zoom feature. We have some privacy set up and HIPAA laws to allow us to have a secure site. And they send them a link through their MyChart, which we encourage all of our patients to use their portal access to their healthcare anyway. There's some interesting things you can do through camera. So if they have a rash or if they have something they want to show me, they can hold it up to the camera and we can do some exam findings. I've had patients kind of press on their shoulder if we're talking about shoulder pain and do some range of motion activities. Some of my colleagues in other specialties have been able to do, neuro exams and other things just by visually observing what's going on the other side of the screen. They can hear me just fine. I'm not wearing a mask and covered in gear, so that's also another positive because we're sitting safely each in our own space. Visits take about the same amount of time as they do in the office, and then when we're done, I hang up. I send them their information via their system so they can follow up if they need to do anything different, medication changes. Everything they could pretty much get in the office, we can accomplish with them being at home, barring some physical exams. So that's been pretty helpful for most of my patients. It's rolled out smoothly, or as smoothly as we could expect. I think we got something like 1,700 or 1,800 providers on board to do this type of virtual visits within a matter of 2 to 3 weeks. So we've learned a lot about what we can do and what we can't do in a virtual visit. The silver lining is that we can find ways of taking care of patients that we didn't think were possible before. We've advocated that there, especially within primary care, some flexibility in terms of scheduling and location and finding alternative ways to meet patients' needs. I think this is something that could come out of this crisis that will really benefit everybody.
We're really thankful and proud that this virtual visit program has really taken off, so our community members have access to care. Please get the word out that if there are any neighbors or friends of yours that have emergent medical care needs, that they reach out, that they go to the emergency room, that they continue to call 911 or contact their primary care physician's office. Thank you for your ideas. I look forward to your additional ideas in the future for next week's Notes from the Field edition. Thank you.